Accutane 40 mg capsule retinoids and derivatives, systemic, is used to treat severe cystic acne, also known as nodular acne, that has not responded to other treatments. It belongs to a class of drugs known as retinoids and works by decreasing facial oil production to help prevent permanent scarring. It is typically taken by mouth and the daily dosage may vary depending on your doctor's recommendation. It is important to take Accutane at the same time each day to maintain consistent levels in your body. Before starting Accutane 40 mg capsule, it's important to read the medication guide and sign a patient information/informed consent form. Always consult your doctor or pharmacist if you have any questions about taking this medication. Take this medication by mouth as directed by your doctor, usually twice daily for 15 to 20 weeks. Swallow the capsules whole with a full glass of water, unless otherwise directed by your doctor. Some brands may require you to take this medication with meals, as food helps increase absorption of the drug into your bloodstream. The dosage of Accutane 40 mg capsule is based on your medical condition, weight, and response to treatment. It's important to note that your acne may worsen during the first few days of taking this drug, and it may take up to 1 to 2 months before you notice the full benefit of this medication. If severe acne returns, a second course of treatment may be started after you have stopped taking the drug for 2 months. However, the manufacturer does not recommend long-term use of isotretinoin, so do not take more than the recommended dose. It's also important to note that women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules, as it can be harmful to an unborn baby. Some common side effects of Accutane 40 mg capsule retinoids and derivatives, systemic, include dry lips and mouth, minor swelling of the eyelids or lips, crusty skin, nosebleeds, upset stomach, or thinning of hair. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless, hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as mental/mood changes, tingling feeling in the skin, back/joint/muscle pain, signs of infection, painful swallowing, or peeling skin on palms/soles. Isotretinoin may rarely cause disease of the pancreas, pancreatitis, that may rarely be fatal. If you develop severe stomach pain or severe, unrelenting nausea/vomiting, it's important to discontinue the medication and notify your doctor right away. Additionally, stop taking this medication and seek immediate medical attention if you experience severe headache, vision changes, ringing in the ears, hearing loss, chest pain, yellowing eyes/skin, dark urine, severe diarrhea, or rectal bleeding. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. It is crucial for women who are pregnant to avoid using isotretinoin, as it can lead to serious and sometimes fatal birth defects, miscarriages, and premature births. Female patients must use 2 effective forms of birth control or completely avoid sexual intercourse for 1 month before, during, and for 1 month after stopping this medication. Monthly pregnancy avoidance counseling from your doctor is also required. Mini pills for birth control should not be used with isotretinoin. If you are late in having your period or have sexual intercourse without using 2 effective forms of birth control, stop taking this medication and contact your doctor immediately. It is important to understand and carefully follow the requirements of the iPledge REMS program to receive this medication in the United States. Consult your doctor and pharmacist for your country's regulations if you live in Canada or any other country. Always talk with your doctor about the risks and benefits of using this medication. Before starting Accutane 40 mg capsule retinoids and derivatives, it's important to talk to your doctor or pharmacist about any allergies you may have to this medication or other related drugs. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. Before using Accutane, make sure to inform your doctor or pharmacist about your medical history, especially if you have diabetes, high blood fats, mental or mood problems, liver disease, eating disorders, alcohol abuse, or bone loss conditions. While taking Accutane, it's important to be cautious in the sun, as this medication can make you more sensitive to sunlight. Using sunscreen and wearing protective clothing is recommended. Also, be aware that Accutane can affect your night vision, so it's best to avoid activities that require clear vision after dark until you are sure you can perform them safely. It's advised to avoid cosmetic procedures such as waxing, laser, or dermabrasion while using Accutane and for 6 months after therapy, as it may result in skin scarring. Alcohol should be avoided while taking this medication, as it may increase the risk of certain side effects. Additionally, playing contact or repetitive impact sports may result in bone problems, and this medication may also affect normal growth in some children. Accutane must not be used during pregnancy or by those who may become pregnant during treatment. If you become pregnant or suspect you may be pregnant, it's crucial to inform your doctor immediately. This medication can also be harmful to unborn babies if handled or inhaled by pregnant women. Before starting this medication, you must have 2 negative pregnancy tests, and you must have a monthly pregnancy test during treatment. If the test is positive, you must stop taking this medication and consult your doctor right away. Breastfeeding is not recommended while using this medication, as it is unknown if it passes into breast milk. It's important to consult your doctor before breastfeeding while using Accutane. It's important to be aware of potential drug interactions that could affect how Accutane works or increase your risk for serious side effects. Be sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Accutane include tetracyclines, vitamin A-type drugs, vitamin A, and drugs that cause bone loss. It's important to inform your doctor of any new drugs you start taking and discuss if you should use additional reliable birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. If someone takes too much Accutane 40 mg capsule retinoids and derivatives and experiences severe symptoms like passing out or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include vomiting, stomach pain, facial flushing, headache, and loss of balance. It's important to seek medical help if you suspect an overdose. It's very important that only the person it's prescribed for takes Accutane 40 mg capsule retinoids and derivatives, systemic, because it can cause birth defects and other serious health problems. While taking this medication, you will need to have regular lab and medical tests, such as pregnancy tests, blood cholesterol/triglyceride levels, liver function tests, white blood count tests, and eye exams. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. Regarding the daily dosage, it's important to follow your doctor's instructions and take Accutane 40 mg capsule retinoids and derivatives, systemic, exactly as prescribed. And as for the best time to take it, your doctor will advise you on the optimal timing based on your individual needs. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed dose. It's important to store Accutane 40 mg capsule retinoids and derivatives, systemic, at room temperature and away from light and moisture. Make sure to keep it out of reach of children and pets, and do not store it in the bathroom. When you no longer need this medication or it has expired, it's important to properly discard it. To do so, consult your pharmacist or local waste disposal company. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.